you suffering from back pain? Well, surgery is not the only answer. There is a simple procedure that can make a difference. Dr. Rivera from the Florida Pain Relief Group is back to explain. Good morning, doctor. Welcome back. So yeah, this particular procedure, because I know there are a lot of people suffering from back pain. I know that's what a lot of people are walking into your office for. Talk about this procedure, though. It's something that I had not heard of.
Yes, it's actually not a new procedure. It's been around for at least 20, 30 years. It is for patients that have what we call axial low back pain. Rather than leg pain, they hurt in the small of their back.
Okay.
It's typically a mechanical pain. It gets worse when they do things, and it's better when they do rest. And it's activity related. We put a needle in the joints of the bones where the lumbar vertebrae hinge on each other.
Okay.
Those joints are called the facet joints. We touch the nerve that supplies that little joint with this special needle that gets hot at the tip, and it sort of numbs that nerve for good.
For good?
For good.
Well, that's what I was going to ask, is how long do you feel the results from this?
Absolutely. Most patients get at the least 6 months to a year, but I actually had it done.
Oh, really?
Yeah.
So you know this procedure very well, then.
Yeah, and 6 years ago, knock on wood, I'm still doing great.
Wow. So who is the ideal candidate? I mean, how do you know that this, can you use it for other parts of the back as well? I mean... Yes,
you can use it for anywhere in the spine, for that matter, because it's a very small nerve. It's what we call a C fiber. It's a nerve no thicker than a human hair. And we can use it for anybody who has pain in the core of the body in itself. So axial neck pain or low back pain.
Are you seeing more men or women kind of deal with this particular pain? You know, I feel like low back pain, us women deal with that a lot too.
No,
but...
it can be done on either sex. However, typical low back pain is typical disease of men.
Okay. So when you have this procedure done, is there any downtime afterwards? What do you tell your patients that they need to kind of prepare and be ready for?
It's no different than any one of the other injections we do. The day off the procedure, yeah, we tell them to take it easy because they're giving a sedative for it. But I tell them the next morning, pretend never happened.
Oh, wow. And you can feel the results pretty quickly? I mean...
Next morning.
Wow.
Yes.
So then, again, how do you find out if you are the right candidate, or this would be something, this almost sounds, I can imagine a lot of people say, I want to try this. How do you find out if you are a right candidate for it? What kind of tests do you have to do?
Yeah, go see your pain management doctor. They will have to do some basic x-rays. They will have to do a physical examination. And then typically patients undergo this procedure in stages. It usually takes 3 steps. One is the diagnostic phase, and then the other one is the therapeutic phase. It's typically called on the laser, cutting of the nerves. People cut. It really doesn't use a laser. It uses a hot needle that gets warm with radio frequency energy. But it's a very simple outpatient procedure.
Well, what's your take home here as we kind of get ready to wrap up, where, you know, again, I know a lot of people are suffering from back pain. I think they tend to go with it maybe longer than they should. They don't know what to do. They kind of just think it's something they have to live with. What's your answer for that?
They suffered enough. And that's my message today. You suffer enough. Go see a pain management specialist. There are options out there that people may not have heard of. And we have them. They're available at our fingertips. Most of them are minimally invasive. They very little downtime, certainly covered by most insurance companies. It's available. It's there.
And I think most people assume you have to have surgery, too, that's the only way to fix it. But it sounds like there may be some other options they need to consider, or at least get a second opinion on.
Of course.
All right, doctor, thank you so much. We really appreciate you being here. I always learn so much from you, and we look forward to having you back.
My pleasure.
All right, again, there is their information, their number to call, their website right there, and we will also put that information on our website, which is tvmorningblend.com.